In 2004, Paul Martin brought in a $41 billion health accord, which promised a 6% increase to federal healthcare transfers to the provinces for the next 10 years. Well, 2 years ago it expired, and what the Conservatives said is that for the next 2 years they will continue the 6% increase, at which point federal healthcare transfers will be tied to economic growth, or 3%, whichever is higher. Dr. Brett Belchetz is with me. He's a senior fellow at the Fraser Institute, an emergency room physician. Let's start there. Did the funds that was being literally thrown at the provinces work to improve the kind of innovation that was needed in Canada's healthcare system?
Well, the answer to that is not a straightforward one. It's both a yes and a no answer. I would say probably more no than yes. The reason that this fund was brought in, this huge package of healthcare dollar increases, was it was well recognized that our healthcare system was one of the worst performers in the developed world. So when you compare us to our peers around the world, we have the greatest wait times for primary care, so to see a family doctor, to see an emergency room physician. We have the greatest wait times for specialty care, and we certainly had the greatest wait times around the world for surgical procedures. So it was thought that by throwing more dollars at the problem, we could improve our performance. And on some metrics, we actually did improve performance. So what certain provinces, for instance, Ontario did, is they implemented wait time strategies where they said, we're going to identify several high volume, high weight procedures, and we're going to pour funds into those to try to bring down the wait times. And so for things like hip replacements, knee replacements, some of these, the wait times actually did go down. But unfortunately, for the rest of the healthcare system, there really was not a measurable impact on wait times. And there's a couple reasons why, because first of all, there was no dollars that were really put into the rest of the system in any measurable way. And secondly, even around the procedures that were targeted as these are the ones that have to be hit, where we really are seeing these as priorities and we want to bring wait times down, what happened, unfortunately, is that all of the increased resources were met with increased demand. And that is a function of what is actually wrong with our healthcare system, is that we have a healthcare system where supply and demand are fundamentally out of balance, because we have a system where the price for healthcare to patients is always $0. So there are no co-payments, there's no cost to a patient for any amount of accessing of the system. And so the issue here is that anybody who studied economics, when you look at supply and demand curves, will know that demand for any service or any good when the price is zero tends to be very close to infinite. So it doesn't matter how many dollars we plow into healthcare if we don't remedy the idea that the price of healthcare in this country is $0, that extra supply that we create with that extra money just gets gobbled up very quickly.
Exactly. So it wasn't the amount of money that was being poured into the provinces that was needed. It was actually that the funding be tied to specific things that would lead to innovation, specifically regarding wait times, because let's face it, the wait times in Canada are deplorable. They just are.
Well, absolutely. So wait times are the biggest problem with our system. And if you look at the 2014 Commonwealth Fund study that came out of Washington, D.C., and the Commonwealth Fund is one of the most respected institutions that compares healthcare systems around the world. They looked at all of the healthcare systems across the developed world. We were rated second worst in the developed world. And of all countries, the reason why we were rated so badly is our wait times. It's nothing else in our system that is the problem, really. It's wait times. So what should have happened, if you want to talk about that 6% increase, is what they should have said is, we're going to devote all this extra funding, but it has to be put in a meaningful way that isn't just doubling down on a system that's broken. We need to structurally reform what's already there.
Now, the Conservatives have said that trajectory of funding is unsustainable, that 6% will literally gobble up the entire budget effectively at a certain point. That they've reduced it to 3%. There's some debate, and we can quibble over whether or not it's a cut or they're saving, whatever it may be, but that they've reduced it to 3%. Will we see the healthcare system fail?
No, we won't, because 3% really in real dollars is flat funding of the system. So across this country, we see population growth of about 1% per year. We estimate inflation to be around 2% per year. Often it's been lower over the last few years. So if we add the 2% inflation plus 1% population growth, 3% is about the right amount to say that we're giving the same amount of dollars in real dollars every year to the healthcare system. So the system's not going to crumble. There are going to be strains. The strains are based around the fact that our population is aging, our population is getting sicker, the costs associated with taking care of this type of a population will go up. The other big problem is, again, going back to the idea that healthcare is free in this country, we have growth in the utilization of healthcare services that is completely out of proportion to the actual growth in the population. So in Ontario, where I work, our population grows at 1% per year along the lines of the national average, but our growth and utilization of healthcare grows by 3% per year. So unless we try to address the fact that our demand growth in terms of what people are using of the system is out of all proportion to what should be expected with the population, we're never going to be able to catch up. So I think limiting expenditures to real growth is a good first step, but then we actually have to look at structurally what can we do to the system to change the way we access and use the system.
Is there an argument to be made that this will somehow incent provinces to innovate to a certain degree? I mean, what about the idea of user fees?
Well, it's a big question mark. So, if you look at the Canada Health Act, it very much stipulates that any province that starts charging fees to patients to use the system will be found to be operating against the principles of the Canada Health Act and can be fined by the federal government. The big question here is, would this federal government go down that pathway? And there's a lot of signs that they might not. So if you look at some of the private healthcare initiatives that have developed in British Columbia and Alberta, you've seen no movement from the federal government to actually penalize those provinces for allowing those to happen. And so one has to wonder if maybe the federal government, part of their thought process is that by limiting, this endless throwing of dollars at the problem, it will force the provinces to open their minds to saying, let's try to bring in money from other sources. And, one of the really interesting things from, I like to talk about this Commonwealth Fund study a lot, but when we look at all of the other countries around the world that they studied, all of them have some form of user fees, all of them have some form of private care, all of them have better wait times, all of them have better healthcare outcomes. And even for those people that are, of lesser means in those society, those people that fully depend on the public system, that don't have the ability to pay user fees, don't have the ability to access their private systems, even they are doing better than people in our public system. So even those people of lesser means in those countries are experiencing better care and lesser wait times than people in our completely public system. So what it says is that there are examples around the world of how a healthcare system can function more efficiently, with less cost to government, with better outcomes, and for some reason we've chosen to ignore it and go our own path. I think we're the only country outside of Cuba and North Korea that has a completely public healthcare system with absolutely no private element of care. And I think it's time for us to not follow lousy examples like that and look at European countries, look at Australia, look at New Zealand, and go down the path that they're going down. So I think the Harper government is actually making the right choice here to say, let's not double down on a system that's not working. Let's leave the funding at real dollars constant, and let's hope going forward that we can innovate somehow to actually address the root causes of the problems in our system.
All right. Thank you, Brett.
Thank you.